Hello viewers, welcome to my continuation lecture number 2. So, in this lecture, we will talk about the treatment protocol for the diarrhea. So, first of all, you will have to prevent the dehydration. The second one is to prevent the fluid loss, and the third one is to maintain the nutritional status of the patient, and the fourth one is to maintain the personal hygiene, and the fifth one is to eliminate the infecting organism where appropriate. So, in case of prevention of dehydration, this is very important since so much of the child's body fluid is being lost through the stools and vomitings. So, you will have to replace the lost fluid as much as the fluid is go into the blood and to the stools. It should be given to the child to drink for replacement. To maintain the nutrition, mothers tend not to give a child who has diarrhea anything or very little to eat, but at that time or at a time when he needs all the food he can get, continue to feed as much as can be tolerated. To maintain the personal hygiene, so maintenance of personal hygiene, it is also one of the essential factor. So, or else you and of taking the germs from the stools back into the mouth, so continuing the diarrhea, you are trying to stop. And the final step is to eliminate the infecting organism where appropriate. So, in simple, the a non-pharmacological treatment keeps surrounding clean. You will have to keep your surrounding clean and neat, and you should improve the personal hygiene like hand washing after toilets and home-based fluid intake. And you will have to maintain your balanced diet or maintain the diet. So, and pharmacological treatment evidence stating the fluid therapy is very important. For example, in case of child with no dehydration, if it is less than 5%, so gets treatment plan A. So, if child with mild to moderate dehydration, that is in the range of 5 to 10%, gets treatment plan B, which we have discussed in detail in our previous lectures. Child with severe dehydration, that is greater than 10%, so it gets treatment plan C. And treatment plan A, when there is no dehydrations, mean no fluid loss. So child can be treated safely at home and instruct the mother to give home-based fluid like rice water, like cocoa soup water and orals rehydration salt, that is ORS. And breastfeed babies should be given breast milk or ORS. Give as much as child wants according to the wants of all the fluid. Look at this table. Number 2, treatment by fluid therapy plan A. For example, if the age is less than 2 years, the ORS basic amount is 500 ml or more. ORS for every extra stool fast, that is 50 to 100 ml. If the age of the child is 2 to 10 years, then ORS basic amount should be 1000 ml or more. And the ORS for every extra stool pass, that is 100 to 200 ml. So if the age of the child is greater than 10 years, then ORS basic amount is 2000 ml or more, and the ORS for every extra stool is 100 to 200 ml. So child should continue to feed and ask the mother to return to the health facility. If the child gets worse, passes more watery stools, so vomits repeatedly and becomes very thirsty, eat or drink poorly or not better in 2 days. Instruct the mother on how to prevent the diarrhea. So, I mean, this is the treatment by fluid therapy and plan A. That, for example, if the age of the child is less than 2 years, or if it is between 2 to 10 years, so this is the protocol and it should be followed because the child should continue to feed. Because with the help of, I mean that whenever there is loss of fluid or electrolytes, there may be chances of imbalance of electrolytes. Imbalance, definitely you need a rehydration therapy. To ask the mother to return to the health facility if the child gets worse. This is very important because the baby become more and more weak. So you should ask the mother to return to the health facility. If the child gets worse, then passes more watery stool or vomits repeatedly, so it becomes very thirsty and eat or drinks poorly. So that is not better in 2 days. So you should instruct the mother on how to prevent the diarrhea. So inshallah, in my next lecture, we will continue the treatment protocol or treatment plan B for diarrhea. So once again, thank you so much for watching my lecture. If you do not subscribe my channel, please subscribe it. And if you need these contents and soft form, so I'm available for any kind of services. Thank you.